With regards to the barriers, as I mentioned, the number of children that a given EMS agency sees is small. It's less than 10% of their total pediatric encounters, and actually 80% of EMS agencies nationally see less than 8 children a month. So it's one like every 3 days, essentially. And so being able to maintain skills to care for a population of patients that you don't see very often is not easy. The other challenge is that EMS agencies across the country predominantly are embedded in municipal fire departments, and those fire departments have a dual responsibility, both to be fire departments to respond to fires, but a lot of what they do is actually respond to 911 calls in the community. Yet that maintenance of lots of different responsibilities tends to kind of pull resources in different directions. And so recognizing that one, children are infrequently seen, and two, municipalities that are fire-based are, have different responsibilities that they need to kind of keep at the forefront of how they serve their community. Those are kind of some of the major barriers. So that's where that role of the PEC kind of comes in. But in terms of where the national resources that regional pediatric centers can provide, there is the Pediatric Pandemic Network, which is a collaboration of now 14 large children's hospitals across the country. And pediatric pre-hospital experts, we are a small but mighty group, and we're growing in numbers every year, are working to develop some of those resources to support EMS agencies. The other primary support to help EMS agencies overcome these barriers are the state partnership EMS for Children programs that are in every state and territory in the country. And these state partnership programs help support EMS agencies in their state, both through readiness recognition programs, through tools and resources that they provide. They often provide education. Some of them are housed within large children's hospitals or universities. As an example, here in Colorado, it's housed at the University of Colorado. But some of them are also housed in state offices. And I think that state offices have good insight into how their EMS system is functioning, and the state partnership program's ability to leverage that state office to kind of support kids is another real resource that EMS agencies can turn to for support. So we were thrilled with the 46% response rate nationally, even though that is less than half of the EMS agencies in the country. We sent the survey, we made the survey available to 15,000 EMS agencies nationally and over a 3-month period. And given that there were 207 questions and it took about 35 to 40 minutes to complete, we were just really super excited to see that as many agencies as that answered the survey as they did. Definitely a predominance of ALS agencies, advanced life support agencies, so those who are able to provide higher levels of care in the community, and also a predominance among our urban and suburban agencies, fewer rural agencies, fewer basic life support agencies alone participated. And there's also our goal was to kind of do a survey of all EMS agencies, regardless of whether they actually transport patients or not. Some EMS agencies respond on scene and then separately have a different agency do the transport to a facility if a transport is indicated. And about 71% of our respondents were transporting agencies. So there is a window that we'd like to look into to see how can we better support our BLS agencies, our rural agencies, our non-transporting agencies who may be first on scene and start some of that critical care that's needed for the child in an emergency. And so the assessment will actually open in May of this year, May of 2026, and it will be open for EMS agencies who didn't do this assessment early on, or even if an EMS agency did do the assessment and has put improvements into practice and would like to see how things improved, it'll be open for anyone to do. I will say that our baseline score of 65, 66, we were quite impressed with that, but it may actually represent the fact that it's a predominantly urban ALS responding population of EMS agencies. And so the real nature of readiness and the readiness score may actually be lower nationally. And I think that that's important to know. So the open assessment will really allow our state partnership program managers for EMS for children that I mentioned before, and EMS agencies looking to do to work in this area to get a good assessment of how they're doing. And then since it's open, it can be redone as many times as an agency wants, and they can use that to track their improvements. Yes, so the higher scores in patient and medication safety, which focused on, do you have resources available at your agency to make sure that you're giving the right dose of medication to a child? Do you have the ability to transport the child in an appropriate safety restraint device, et cetera? And also, do you have all the recommended equipment? There's a national guidance on what's all the recommended equipment for ground ambulances. And this infrastructure is already present. What we were really impressed to see these existing policies, the existing guidance on safety, the existing equipment is all there. But what EMS agencies have to do is do a self-check and assessment of, are they using it appropriately? Are they following their policies? Are they giving the right dose, even though they have a medication dosing guide? Are they doing the quality and performance improvement work that we first talked about to see if the right dose is being given? Are they also doing skills checks with the equipment? I have been fortunate to be an EMS educator in our state, and when I am doing simulation and we have them use their own bags of equipment, sometimes during the simulation and in a debrief, the EMS agency participants will say, well, gosh, I haven't used that equipment in a really long time. I wasn't even sure where it was on the bag. So even though agencies can say they have the equipment, doing skills checks with that equipment at least twice a year is a really key thing to kind of help build those skills. It helps people remember where the equipment is, how it's indicated in being used, troubleshooting if there's a failure of the equipment. These things require practice in order to improve performance. So really excited to know the higher scores in that baseline infrastructure, but leveraging the infrastructure and making sure it's really working for the agency is really the next step.